Hello guys. Welcome to Ditani Tech. Here in this video you will know that what is epilepsy, how it occurs, its symptoms and what is its treatment. Let's move towards the video. Epilepsy is a group of neurological diseases, and it's characterized by recurrent seizures. Seizures happen when there's a sudden surge in the brain's electrical activity. Depending on which part of the brain is affected, a seizure can look like a loss of awareness, unusual behaviors or sensations, uncontrollable movements, or even a complete loss of consciousness. The brain, it's incredibly complex, made up of billions of neurons. These neurons can either be excitatory or inhibitory. Excitatory neurons, they stimulate other neurons to fire electrical signals, sending messages through the brain, while inhibitory neurons, they suppress this process, preventing excessive firing. And keeping the right balance between these is crucial for the brain to function properly. But in epilepsy, something goes wrong. There's an upregulation of excitation or a downregulation of inhibition, and suddenly, tons of neurons fire all at once, synchronizing in a way they shouldn't. If this abnormal surge happens in just one part of the brain, you get partial or focal seizures. If it spreads throughout the whole brain, that's when you get generalized seizures. Now, partial seizures split into two categories, simple partial and complex partial. In simple partial seizures, the affected part of the brain may cause strange sensations or jerky movements, but the person remains aware of their surroundings. On the other hand, complex partial seizures lead to a loss of consciousness or changes in awareness, or the person might not respond as they usually would. Then there are generalized seizures, and these break down even further. Absence seizures are the most common in kids, and they're marked by a very brief loss of awareness. Usually, it looks like a blank stare, sometimes with subtle movements like lip smacking or eye blinking. People who have these may not even realize something's wrong, and it could go unnoticed for years. The good news, though, is that many kids with absence seizures grow out of them without needing treatment. Tonic seizures involve muscle stiffening, which can cause the person to fall, often backward. Atonic seizures, also known as drop attacks, are when the muscles lose all their tone and cause the person to collapse or drop to the ground, sometimes without warning. Then, clonic seizures involve rhythmic jerking movements, mostly affecting the neck, face, arms, and legs. Myoclonic seizures are like sudden jolts, where muscles twitch or jerk, almost like being shocked by electricity. And the most dramatic ones are tonic-clonic seizures, also known as convulsive seizures. These are a combination of muscle stiffening and jerking, and they're the type that most people think of when they imagine a seizure. They also come with a sudden loss of consciousness and sometimes bladder control. If a tonic-clonic seizure lasts more than a few minutes, you need to get medical help immediately. Epilepsy can develop due to many things: a brain injury, a tumor, a stroke, a previous infection, or even a birth defect. When generalized seizures start in childhood, they're often linked to genetic factors. Epilepsy caused by just one gene mutation is rare. It's more often a mix of several genes and environmental factors that causes it. Hundreds of genes are involved, including ones for GABA receptors, which are crucial for keeping things in balance in the brain, and ion channels that help neurons transmit signals. There are also genetic disorders and metabolic conditions that can cause epilepsy as a primary symptom. In about half of cases, the cause of epilepsy is unknown. To diagnose it, doctors observe the symptoms, take a medical history, and run an electroencephalogram (EEG) to look for abnormal brain waves. An EEG can also help doctors figure out whether the seizures are partial or generalized. And sometimes, genetic testing is helpful, especially when there's a suspected genetic cause. Unfortunately, there's no cure for epilepsy, but there are treatments available that can help control the seizures. Medication controls seizures in about 70% of cases. There are many anti-epileptic drugs available, and they work by targeting things like sodium channels, GABA receptors, and other components involved in how the neurons fire. Different medicines help with different types of seizures, so patients may need to try several drugs before finding the right one. For some patients, there's also dietary therapy, like the ketogenic diet. This special high-fat, low-carb diet has been shown to reduce or even prevent seizures in many children who don't respond to medication. It forces the body to use fat for energy instead of carbs, and while the reason it works isn't fully understood, it can be quite effective. Another option is nerve stimulation therapy, such as vagus nerve stimulation. This involves placing a device under the skin, which sends signals to stimulate the vagus nerve at a certain rate, acting like a pacemaker for the brain. While the exact mechanism isn't clear, it has been proven to significantly reduce seizures. Finally, in some cases, surgery may be performed to remove part of the brain that causes the seizures. This is usually done when tests show that the seizures come from a small area that doesn't control any vital functions, making it safe to remove. At Children's Hospital Colorado, we offer various treatments to help children with epilepsy, including traditional anticonvulsant medications, dietary therapies, access to ongoing drug studies, vagal nerve stimulation, and even epilepsy surgery. Surgery is often considered when epilepsy is very localized and hard to treat with other methods. To figure out if surgery might be an option, the epilepsy neurology team has several tests they use. These include a prolonged vedio EEG, done during a stay in the epilepsy monitoring unit, an MRI, and functional imaging like PET scans, MEG scans, and others. These tests can help pinpoint the exact areas of the brain that are causing the seizures. Once we gather all this information, a team of specialists, including doctors who focus on different areas of epilepsy, meets together in a conference to discuss it all. They'll then make recommendations about what kind of surgery, if any, should be considered. If these non-invasive tests aren't able to fully localize where the seizures start, there's a procedure called stereo EEG, which helps identify the exact spot of seizure onset. In stereo EEG, thin wire electrodes are temporarily placed into the brain using a precise robotic guidance system. This can give us a much clearer idea of where the seizures are starting. When it comes to surgery, there are different options, depending on the type of epilepsy. The most common technique involves open surgery, or a lesion or even an entire lobe of the brain might be removed. This is usually done to stop seizures. In some cases, there's a minimally invasive approach using a laser fiber, which can treat smaller, localized lesions. If an entire hemisphere of the brain is severely injured and causing seizures, that hemisphere might be disconnected. For patients whose seizures are coming from broad areas of both sides of the brain, one option is placing a pacemaker-like device called a vagus nerve stimulator. This can help reduce seizures. Another option for these cases is disconnecting the corpus callosum. There's also the option of placing an intracranial stimulator, like the responsive neural stimulator, RNS. This can offer seizure relief for patients whose seizures are coming from critical brain areas. At Children's Colorado, we understand that every child is different. We know that epilepsy has many different causes and requires many different treatments. Our team of experts will work together with you to provide the best possible treatment for your child, tailored to their unique needs.